Hello and welcome back to the Rip and Rise Roadmap. I'm Dr. Catherine Muyeba, your host, and I'm so glad that you are here. If you have been following for a while, you will know that we're uncovering how different areas of life impact mental well-being. And today we're diving into vocational health, how our work life and career experiences shape our mental health and well-being. According to their publication in September 2024 about mental health at work, the World Health Organization reported important facts. Decent work is good for mental health. Poor working environments, on the other hand, pose a risk to mental health. And this includes, but not limited to, discrimination and inequality, excessive workloads, low job control, and job insecurity. And globally, an estimated 12 billion working days are lost every year to depression and anxiety at a cost of $1 trillion per year lost in productivity. The publication continued that there are effective actions to prevent mental health risks at work, protect and promote mental health at work, and support workers with mental health conditions. And whether you are navigating workplace bullying or burnout, this episode will speak to the challenges and provide practical steps for finding balance and hope. So let's get right in. So as we've noted, work is an integral part of our lives. It's not just about earning a living, it's about purpose, identity, and contribution. And when vocational health is compromised, it can ripple across every aspect of mental well-being. And here's how poor vocational health affects the WHO definition of mental well-being. So number one is about coping with stress. Workplace challenges can feel overwhelming, making it harder to manage life's pressures. And number two, recognizing potential. Unfulfilling or toxic work environments can stifle our growth and confidence. And number three, productivity. Stress and disengagement can reduce our ability to function effectively. And number four, community contribution. Job dissatisfaction or unemployment may make us feel disconnected and undervalued. We discussed relational health in previous episode, and we can see how work can be integral to social inclusion and an opportunity for people with mental health issues to make meaningful contributions in the community. So let's explore these impacts through two relatable stories. Let's look at Alexis. She's a 32-year-old GP or general practitioner who endured workplace bullying from a colleague who undermined her work and spread rumors about her. And despite excelling in her role, Alexis began to dread going to work and felt her confidence erode. The impact on her mental well-being was profound. She struggled to cope with normal stressors of life, feeling anxious and on edge on a daily basis. And realizing her potential felt impossible as she started doubting her abilities. Nothing she ever did was good enough in the workplace. Her productivity declined as she spent hours ruminating about the interactions with her work colleague. Alexis was at a weekend break with her friend when she attended a seminar where the RIP framework was discussed. At first, she was skeptical about the difference this would make, but she took notes. And when she got home, she started working through the framework and found clarity. And as she reflected on the situation at work, she recognized that the bullying was not her fault. And she envisioned a future where she worked in a supportive environment, surrounded by colleagues who cared and valued her vast experience as a general practitioner. Alexis analyzed her options, including reporting the bullying. She felt the need to involve a critical friend for that extra support. She also started considering external opportunities when things appeared to move from bad to worse. Over the next few weeks, Alexis planned the evidence and reported the incidents. The HR investigation took its course, and there was sufficient information to make significant changes in the workplace. Alexis decided to stay in the same GP practice, and this time she felt valued and supported. Her story is a reminder that we deserve workplaces that respect and uplift us. And what about the story of Felicia, a senior nurse running a really busy mental health ward? And at 39, she had over 15 years of experience and she loved her job. However, she struggled with the relentless demands from the management and was putting in long hours most days. Over time, she began to experience recurrent physical symptoms like headaches and fatigue. She was getting emotionally drained and detached from the patients that she once so deeply cared for. Burnout took a toll, and Felicia's mental well-being declined. She found it hard to cope, feeling like she was constantly running on empty. Her passion for nursing waned, and her productivity suffering, making frequent mistakes at work, and this was adding to her stress. The Health and Safety Executive Report from 2022 to 23, which used data derived from the Labour Force Survey in Great Britain, showed that 875,000 workers suffer from work-related stress, depression, or anxiety every year, resulting in 17.1 million working days lost. Felicia was forced to stop when her blood pressure shot up so high she needed to be admitted to hospital. And 3 months later, as part of her return to work, her colleague shared the Rip and Rise journal with her. Felicia had choices to make. She reflected on her workload and admitted that the old way of doing things was no longer working. She envisioned a healthier work-life integration where she could take care of herself as well as the patients. She could be in a place where she could take regular breaks and learn to identify those warning signs when her body was tired. She analyzed her responsibilities, delegating tasks where possible, and speaking to her manager about adjusting her schedule. Felicia then planned the ideal work week when she returned to full-time hours. She was back to her usual vibrant self and was well aware about being intentional to maintain this. The regular self-care routines, mindfulness practices, and ongoing therapy helped her build her resilience. Felicia's experience underscores the importance of prioritizing our own well-being, even in demanding careers. Alexis and Felicia's stories show how challenges in our vocational lives can deeply affect our mental health. And if you are struggling with vocational challenges, here are some steps to consider. Number 1, take a step back and assess the root cause of your dissatisfaction or stress. Number 2, picture a time when you are in the kind of environment or career which aligns with your values and your strengths. And number 3, identify the gaps in your skills or opportunities for change, whether through upskilling, seeking mentorship, or exploring new roles. And number 4, take actionable steps, whether it's updating your CV, networking, or seeking professional support. Getting help is not a sign of weakness. In our next episode, we'll explore financial health, a topic that can be both empowering and challenging. We'll discuss how financial struggles affect mental well-being and provide tools for building a healthy relationship with money. Thank you for joining this discussion on vocational health. And if this episode resonated with you, please share it with a friend or colleague who might find it beneficial. And don't forget to subscribe and visit the website on catherinemuyeba.com for more resources. And until next time, remember, you are capable, resilient, and deserving of a vibrant and fruitful life. So let's reap and rise together.